Welcome to today's webinar, Let's Talk, Ending Stigma at Work, Dispelling Mental Health Myths. So today's presentation is brought to you by WorkWell NYC, the city's worksite wellness program. We're here to help you live well and be well. Our goal is to create work sites that make it easier for our employees to live healthy and active lifestyles. Health is not just the absence of disease, but health is physical, mental, financial, and emotional. And we know that health exists on a spectrum, and we are here for you with health and well-being programs and educations and support to help you move more, eat well, take action, and to prevent disease, no matter where you are on your health journey. So I'm not sure if you realize, but approximately 1 in 5 New Yorkers experience a mental health challenge each year. And Be Well is very excited to present our newest initiative, the Let's Talk campaign. Let's Talk is WorkWell NYC's campaign to eliminate mental health stigma in the City of New York workforce by creating supportive workplaces and building resilience in employees. We'll talk more about our campaign towards the end of the webinar. So let's get started. In today's webinar, we will define stigma, we will dispel any kind of mental health myths and talk about the facts. We'll highlight useful resources, and we will talk about ways that you can support your coworkers. So for today's presentation, I am Ayana Mbonu. I am the Be Well Program Manager. Be Well is the mental health portion of the WorkWell NYC Wellness Program, and we're joined today with our special guest, Kerry Simon. She's the Associate Deputy Director of the Employee Assistance Program, and Linda Ford. She's a Clinical Supervisor at the Employee Assistance Program. And they will share their knowledge and expertise on this very important topic.
Let's talk about stigma. In this series, we will explore common myths about mental health and empower you to take action to support yourself and your colleagues' emotional well-being. Mental health stigma can be negative attitudes and discriminating behavior directed towards someone with a mental health condition. Stigma can also be a perception of your own mental health condition that leads to feelings of shame and self-neglect.
I'm glad you all can hear it. What do you think stigma is? Take a moment. Is it judgmental attitudes, discriminating behavior? Do you think it's perceptions leading to shame or neglect? Or are they all of the above? So if you could just take a moment and choose what you think is the right answer, and then we'll share the answers. All right, let's see what the answers. Let's see what you all think. Okay, so it looks like most of you believe that all of the above. Stigma involves judgmental attitudes, discriminating behavior, as well as perceptions leading to shame or neglect. All righty. So, Kerry, Linda, would either of you like to talk a little bit about stigma, especially how it applies to what we're going through right now?
Yes. Hi, this is Kerry Simon. Stigma is like a negative mark on someone that it puts them into a stereotyped group. It's a perception you have of them negatively. It can induce feelings of shame, blame, and loneliness. And it prevents us from openly talking about mental health issues and prevents people from seeking help. So, throughout this webinar and Let's Talk and us at EAP, we really want to set a tone of openness and education and awareness and curiosity about what stigma is to shift the language we use and the way that we see someone, going from what's wrong with them to what's happening for them. And that'll shift the stigma. Linda, you want to say
Yeah,
anything?
and one of the other things of it is, it's one of the populations where people are really excluded because of their fear of being stigmatized in terms of going to the doctor, going to the dentist, doing things that need to take care of themselves to promote much more better mental health. But because of the stigmas and the fear, they shy away from the things that are very important. So their health is neglected, absenteeism in the workplace, people live in silence and they're very invisible in terms of their mental health issues.
Awesome. Well, thank you for sharing that. We're going to move on to the next slide, and we're going to watch our next video.
Number 1, the workplace cannot be a supportive environment for people with mental health challenges.
Why did my boss select me to give a presentation in front of our directors? He has no idea I hate public speaking. I get so nervous and it gives me extreme anxiety. I can't get anything right and I always mess up. I end up sounding stupid. This time when I tried to back out of it, he said, "It's too late to back out now. Get yourself together."
1 in 5 adults in America experience a mental health condition, with anxiety being the most common. Nearly 40 million people in the United States experience an anxiety disorder in a given year. Because so many working Americans deal with mental health challenges, it is important to build a safe, supportive, and inclusive work environment.
All righty. So we're going to do another poll. We'd like to get your take on this question. The workplace cannot be a supportive environment for people with mental health challenges. What do you think? Do you think that this is a myth or a fact? Please log your answer. Okay. Some people think it's a myth. Let's see. Some people believe it's a fact as well. Okay, well, let's see. What are the answers? Okay, so most of you believe that it's a myth. Alrighty.
Yep.
Carrie, Linda, would you guys like to tell us which it is? Is it a myth or is it a fact?
It's a myth.
Yeah, Linda, you want to go first, Linda? Go for it.
It's definitely a myth because, in terms of, that it can be a supportive environment, in terms of really looking at the issues around working in an environment, you can create an environment that's very healthy for people. Sometimes, we have support animals. It doesn't have to be a dog or a cat, but it can be fish in the midst of an environment that can be real calming for people. A personalized workspace that people can be in to kind of put their own personal plants and different things. Lighting can be included to assist people with having a more of a supportive environment. So, and also healthy walks, encouraging people to take a walk at lunchtime and to be able to help people begin to kind of have a calming day throughout an environment that can be very helpful and supportive of them going through in their work environment. And so there are challenges, people come to work, sometimes because they have to be there and it can be very sad. It's important that you go and just check on someone, do a check-in and just say, hello, how are you? And maybe someone will speak to you. So there are challenges, but also the work environment can be very supportive as well.
Yeah, I agree with Linda. And, I do want to comment on, there was some people who thought it was a fact. And I think that means that there still is work to do. I think that there are many supportive work environments. And that means down from leadership below is that you have an environment that is open and trust, and that there's a level of vulnerability. If a supervisor or leadership is open with their own kind of emotional compass, they will feel more compassionate towards other staff, and there's able to trust and openness to be able to have a safe work environment. Some people don't feel comfortable opening up in some places, but that's what takes education and discussing a mental health need like it's a medical condition. It's like anything else that people may struggle with.
Mm-hmm. And so we do have a question or a comment, and it's relating to an agency and organization having to determine that mental health is important and a priority for their staffing. And so what is EAP? Can you tell us just a little bit about what EAP does to kind of help to engender that kind of support for its management and employees?
Yeah, we do it on both levels. So, you know, as everyone knows, we're a confidential support system for any city worker and their families. So if any worker reaches out to us, and some of which that they need to navigate is a trusting work environment, we can help with like coaching techniques and de-stressing what they're going through in order to help them navigate that space. We also provide support to supervisors and managers. We run groups and individuals for managers that do need to kind of reorganize how they think about mental health, how they can support their staff better. And we do have those managers to reach out and say, hey, you know, I need to work on this and I need to improve my own perception of certain things.
Mm-hmm.
And also super leadership to be, you know, mindful of the fact to really try to get to know your employees and to be able to have the opportunity so that you can do a check-in and just speak to people and say hello and see how they're doing. And if that's done on on a regular way, you have a tendency to get to know your employees and find out if something is going on without being intrusive and trying to get into their business. And I also think that putting up signs in the organization around EAP and where you can get help will be very helpful so that people will begin to see that this is something that's, you know, encouraging, and that they can see that they can go with a telephone number without having to be told, or at least they can say, you know, they're thinking about us, they're concerned about us. We have opportunities and numbers to call if we need some help.
So just before we go on, we do have one question about what is EAP.
Sure.
If you can just tell us really briefly before we go into the next video.
Sure. So Employee Assistance Program is a free service for any city worker and their family members. We provide emotional and behavioral support. We can do short-term counseling. We can do one session if you just need to talk about your stressors that you're going through. We help you find resources that you may need, any type of social service resources or any case management. We also have a really good relationship with the city health insurance. So if you come to us, you just want to talk to some of our counselors for a couple of sessions, then we'll help you get a therapist for more long-term care. All of our counselors are licensed. They're specialized in children, adolescents, and adults. And I mean, I think they're pretty wonderful. And everything's confidential. Anything you share with us does not leave us unless you want us to.
Mm-hmm.
Alrighty, so I see that there's some more questions about EAP. So we will expand on the services of EAP at the end, okay? So we're gonna move on to the next video.
Myth number 2, people with mental health problems lack the competence to meet the demands of work.
None of my coworkers know that I suffer from adult ADHD. When I overheard gossip about my impulsiveness in meetings, I was hurt. Most of the time I can focus, but sometimes I lose concentration. I wish my coworkers treated me better instead of talking behind my back.
We can help create a stigma-free environment by knowing the facts about mental health issues, educating others, and not participating in harmful stereotyping. Everyone experiences struggle at work and stressful situations at some point in their life. For some individuals who live with a mental health condition, they may experience additional challenges. However, people with mental health challenges can be just as productive as other employees.
People with mental health challenges lack the competence to meet demands of work. Is this a myth or is this a fact? What do you think? Take a moment to answer the poll. All right, some people think it's a myth. Myth. Okay, well, let's see. What does everyone think? It's a myth, guys. Know your stuff. Yes. So, Carrie, would you like to share?
Sure. I mean, I agree with everybody. The competency and your mental health have nothing to do with each other. When you are going through a struggle, it can blur your ability, when someone's struggling with something, even with a medical condition, if you're struggling with something, it can impact another part of your life. That does not mean if you have a mental health struggle, you are not competent. And I think that goes with, you know, the language we use and understanding. So when you see a coworker struggling, the hope is you see them as what's going on for them rather than what's wrong with them and why can't they do their job. Rather being curious about it, and I wonder what's happening for them, I wonder what they may be going through. A very different approach to someone maybe not performing up to what they usually do.
Mm-hmm. And that's really important because people are, they may have depression, but they are not depression. And that's important to really look at something that they have versus what they are and identifying that. And also need to look at all of the other people, famous people in the world who have mental health issues and have been very, very successful, from Michael Phelps and Simone Biles and Justin Timberlake. A lot of these actors and professional people have suffered from depression, OCD, and all of those kind of mental illnesses, and they have been very, very successful in their lives. Yes, maybe most of them may have the means to get mental health services and be seen in a certain way because they are famous, but nevertheless, they have suffered from those illnesses and have been very, very successful in their lives.
Well, thank you for sharing, ladies. I know that we reported in the beginning of the webinar that 1 in 5 New Yorkers is suffering with a mental health challenge. We are a workforce of almost 400,000 people. Mm-hmm. So it's very likely that one of your coworkers is struggling with someone. Mm-hmm. And we know for a fact that a person who may be struggling with a mental health concern is more likely to ask for help if they are approached by someone in a loving and engaging way. They're more likely to access help. And so this is something that we can all do ourselves in offering empathy and support and resources to people who we work with, to let them know that we see you, you're not alone, and there's help if you need it. Don't want anyone to diagnose anybody, but just if you notice that your coworker is not the way that they normally are acting, they don't normally behave with you, then just reach out and say, hey, let's talk. Is everything okay? All right. So let's move on to the next video.
Myth number 3, having a mental health illness is a sign of weakness.
I've been dealing with insomnia over the past year. I've tried so many things to cope. I'm concerned because this is my performance review, and I'm wondering if I should tell my boss that I'm tired all the time because I'm not getting enough sleep at night. But that could make me look like I'm making excuses, and she hates excuses.
Mental health problems have nothing to do with being weak, even if these problems affect your work. If you are facing mental health challenges that impact your work, deciding whether to tell your supervisor can be difficult. It may feel uncomfortable and cause you to fear being perceived as unable to handle the workload. However, it's important that you advocate for yourself. Being upfront with your supervisor about your mental health challenges and needs can create a safe space for you and offer much needed relief too.
Having a mental health illness is a sign of weakness. Is this a myth or is this a fact? Please choose your answer by answering the poll. And if unfortunately you can't see the poll, then just go ahead and put your answer in the chat section. So let's see. What are the answers to our poll? What do most people think? Okay, absolutely. I guess I'm answering for everyone. Absolutely. Having a mental health illness is not a sign of weakness. Carrie, would you like to share your thoughts?
I would. So it's absolutely. A mental illness is not caused by a personal weakness and is not cured by a personal strength. So it's not a character flaw. It's a complex combination of genetics, biology, social and environmental factors. And in fact, seeking and accepting help is a sign of strength. And during this time, during this pandemic, I want to say we're saying mental health illness, but we're all, I could say, guess to say, we're all struggling in some emotional behavioral way. Everyone has experienced some level of stress or emotional being that has been a struggle. So that goes back to creating a workplace that is safe, where someone can be vulnerable and someone can be open and brave to share what they're going through. And that in and of itself is a sign of strength.
Absolutely. Linda, would you like to share?
Yeah, and I think that what's going on now with all the webinars and all of what's going on, people are beginning to share a lot of their feelings and talking about to each other. So the more people talk about it and share about it, we're all the same. We're going through the same boat. So that takes away that whole myth about it being a weakness. We're all struggling through the same issues and on a daily basis trying to get through this pandemic. So we are being vulnerable and we're becoming strong in terms of finding out what people are doing to try to get through this.
So I see a question about speaking with the supervisor, especially since the supervisor may be the one that is expressing some sort of stigma. And that's what our Let's Talk campaign is. It's not just for the frontline person, it's for every level. It's for the entry-level person all the way up to the commissioner. And so our campaign really is to change the culture of our workplace. And that means everyone learning that it's only better for everyone that we are open, that we are supportive, that we are encouraging, and that we do not characterize people or label people or try to diagnose people. We are there and encouraging people to just be open and caring about one another and one another's health, because this is really telling because of the position that we see ourselves in now. But this is also and should always have been a initiative that is important. Stigma is not something that I know I can probably speak for everyone. It's not something that we want to continue. We want to make sure that, especially with us returning back to work, or the thoughts about returning back to work, want to make sure that returning back to work is encouraging, is supportive. So thank you for everyone in sharing your comments. Let's move on to the next video.
Myth number 4. All cultures view mental health the same way.
I'm like always stressed, worrying about everything from work to family to relationships. Sometimes I share these things with my friend at work, and then she goes on to tell me about her stressful life. Whenever I hear what she's anxious about, it seems so insignificant. I wonder why she can't handle the simple things in life. She doesn't have half of the problems I have.
People of all races, ethnicities, socioeconomic statuses, and genders experience mental health challenges at some point in their life. Many people have culturally based attitudes and different approaches to mental health. While we all view mental health problems through a different cultural perspective, it's important that we refrain from developing negative attitudes and beliefs toward people who have a mental health condition. Studies show that people with mental health issues who seek professional help and treatment are able to live, work, learn, and participate fully in their communities.
All righty. Time for another poll. Do all cultures view mental health the same way? Log your answer on the poll that you see on the screen, please, or in the chat section, whichever works for you. All righty. Okay, in the chat section, most people think that it's a myth. Oh, and it looks like everyone, or not everyone, but most people think that it's a myth as well. So thank you for choosing. Terry, Linda, which one would you?
Linda, you want to
Yeah, culture is one of those things that, because of the fact that we have so many different cultures, within socioeconomic classes, that people deal with coping skills in so many different ways, where someone who may have been raised in a very high volatile area may be able to handle stress a little bit better than someone who hasn't been exposed to that, or someone who's been in an environment where it's just been chaos all the time. They may not be able to have those great coping skills. So culturally, it's really difficult to really put a real major answer to that, but people deal with things very differently based on the environment, where they come from, the support systems that they have, be it a religious or spiritual environment, or a strong family connection, or, in terms of a family that you have grandparents who are raising children to provide them the support that their parents can. So culturally, it depends on what the culture basically does when people are dealing with stressful issues, and also in terms of different attitudes around what people call mental health. So they deal with it in very different ways. So we just have to make sure that we match a person's cultural experience with a therapist that can be able to help them, and be mindful of the fact that we all see things very differently. And just because one person may see it very minimal, it may be a major issue for someone else.
Yeah, and with culture, again, just to piggyback on what Linda said, culture can encompass religion, ethnicity, gender, sexual orientation, family background, and you put all those together, everyone is a human who uniquely sees and feels mental health in a different way. And culture can affect the way in which people describe their symptoms, right? So essentially, it may dictate, if someone feels uncomfortable, they may say what they may not express their symptoms in a way that will reflect badly on them based on their culture. So it's really good to be curious about coworkers and leadership and supervisors, to understand their cultural background and to understand what they do and don't understand, and to cross-educate each other about how it not only impacts you, but it impacts the people around you.
All right, thank you, ladies. We do have a question before we move on to the next one. A person is asking about the panel and whether this is a conversation about mental health disorders or serious mental illness. And Carrie, can you share how these myths are related to, on the spectrum, that mental illness is on the spectrum?
I think this is about everything. I think that it's about someone who has gotten a diagnosis, to someone who struggles, to someone who's, all of us are going through a pandemic. So I like the question, because I think that it's highlighting that actually a lot of the stigma does go to particular types of presentations of people, right? Some people who present a certain way, whether it is you have struggled with diagnosis of schizophrenia or a diagnosis of bipolar, there are a lot of stigmas that come with that. And then that's why certain times people hide things and people don't feel comfortable being vulnerable and open. But this is about everything, and really deconstructing our perception about certain ways in which people struggle.
Mm-hmm. So it's not just like, I would say, my lifetime Sundays when I'm feeling sad and just want to sit in the bed and watch TV. I'm that kind of person who may be having that type of struggle, right? That's very low, but then there's also, these things also are applicable to the person who has a diagnosis and a serious mental illness, right? And so the workplace.
I think that's where you got a lot of, I think that's the highest impact. I mean, we can talk about that, and also culturally, and all of those things come together to, some people are more oppressed by stigma than other people.
Right. And no matter the level of mental health challenge or illness, the workplace should and will and should be and could be a very supportive place for everyone, correct?
And it also gives the opportunity for
the hope.
Mm-hmm. Okay. The opportunity for people to begin to, to have this conversation, to think it through, but also the less you address the issue, the more problematic it can become. And so therefore, providing this service to the organization is giving people the opportunity to do some thinking and think about what their needs are, and to be able to know that there are services available. And the EAP will help you identify those issues and many others to prevent long-term issues that may become more problematic.
Mm-hmm. All righty. Well, thank you, ladies. This is a really healthy conversation. So we have one more quiz, one more poll. Which of the following on this poll contribute to mental health challenges? Are they biological factors, life experience, family history of mental health challenges, or all of the above? Do all the above items contribute to a mental health challenge? Please log your answer in the poll. Okay, some people say all of the above. All right. So this one is interesting because everybody who voted said all of the above. Okay, well, ladies, what do you think?
Well, I think that this webinar is going well then. I think, everything is different, right? There's certain biological, life, family factors. And the most important thing that I want to share is that you're all going to go through something. And what's really important to connect as we see these mental health challenges is to deconstruct how we see them. And what's important is to build a meaningful, valued life. So when we're trying to reorganize how we see mental health in the workplace, what's important to people should come first, and not necessarily what's wrong with people.
All righty. Linda, would you like to add anything to that?
And just, when we're talking about 1 in 5 people will experience some form of mental health or crisis in their life, it's inevitable. And the cause of it, biological, life experiences, family, it's a combination of everything. And that's all, and we all have experienced those things.
Awesome. All righty. So I'm just going to recap the things that we've discussed so far. Stigma is a barrier to getting help. It's due to judgmental attitude, discrimination, and perception. The workplace can be a supportive environment for people with mental health illnesses and challenges. A stigma-free work environment increases productivity, and communicating about a mental health illness is a sign of strength. Different cultures view mental health from their specific lens, and even within cultures, people within the same culture will think about their mental health with their own specific lens on that particular topic. And lastly, challenges. Mental health challenges are determined by several factors, as you see here, and we all can do our part. So let's move on to the next slide, please. So Let's Talk campaign. This is a great way for us to transition to our Let's Talk campaign. The mission of Let's Talk is to eliminate mental health stigma in the city of New York's workforce by creating supportive workplaces for our employees. Let's Talk campaign aims to do this by promoting education, awareness, and knowledge about mental health at work. Let's work and join us in supporting your coworkers and helping to change the culture of mental health in the workplace. You can demonstrate your support by signing the Let's Talk pledge. We will indicate in the chat section the link so you can sign the pledge. And several ways that you can continue to get involved. We have a webinar coming up next Wednesday. It's financial fitness. That will be actually not next Wednesday. It's actually Friday, May 29th at 12 p.m. And next month, we have a men's mental health webinar. That will be June 17th. That's a Wednesday at 12 p.m. You can also follow us on Instagram. And we're not done yet, so don't anyone log off. We are going to answer many more questions. So let's go to the next slide. All right. So how can you actually what will you do when pledging your support? So when pledging your support, you will recognize that mental health is an important component of our overall health and well-being. You also pledge to make mental health a priority in our workplace. And you will reach out to and support your colleagues in any way that you see that might be helpful to your colleague. And like we said before, we're not diagnosing anybody, but we are opening up and providing a listening ear to our coworkers to just provide some sort of support and resources if they need it. And we will hope that you speak out against mental health stigma. I hope that you have learned something from this webinar and that you're able to share this information with your coworkers. In the follow-up email, you will receive this webinar with all the information and resources as well. So ladies, let's open up to questions. Let's open up to questions. We can get to our resources when we end our questions, okay? So we do have a question. How do you approach your supervisor when your mental health is impacting completing your work and not make it look like you're just being lazy?
I mean, I think that's a really good question. I think a lot of people struggle with that. And sometimes, again, that's that idea that people have this ingrained idea that it's a weakness. And it's the language you use, and it's the comfortability you feel with your supervisor, right? So someone who has a safe, comfortable relationship with the supervisor can talk to them and say, hey, you know, I'm struggling with this, and I see that I'm not doing this up to my par. And that is a safe environment to share. If it's not, then, you know, we at AP can help with like coaching the language around it and helping you with that or the stress around that. But it's certainly a risk, right? I think there's a fear with it, but I will say that there's a lot of times when the fear doesn't meet the fact. So I've been surprised in my previous jobs where I've shared something and people have had wonderful responses. I think that there's the risk and the reward, and also continuing to educate and understand goes a long way. Linda?
And I think that, you know, having the EAP number, you can always call. There's no barrier to picking up the phone and call and making an appointment to come in to share it with someone who will be open to listen to what you have to say and help you navigate with your supervisor in your workplace. That may be the opposite way of trying to handle that situation.
Mm-hmm. Someone else asked if this webinar can be hosted again soon. It looks like they're getting a lot out of it, and that's really great. And someone asked if the anxiety is caused by the supervisor, what do they do? Someone also asked what do they do if their actual administrator is having a mental health issue? How do they suggest services, or how do you provide the services or information if you're going up the ladder? It's an interesting question.
Yeah. And I think across the board, what we can sometimes do is just clearly just ask the question, hey, how you doing today? Or is everything okay? I mean, if there's a comfortable level of relationship there. It is hard to see if your boss is going through something and you would like to make a recommendation. You can, again, I'm not trying to promote EAP, but this is what we're here for, right? We're mental health experts, and we can help, really talk it through to navigate a conversation like that. It is very difficult, especially when we're still working through the idea about talking about mental health is uncomfortable. But we have to get to a place where it is comfortable, and that takes risky conversations, being authentic, and being vulnerable.
Alrighty, thank you. And so we have only 15 more minutes. Let's go through the rest of the slides. If we have more time to answer questions, we will. Okay, so let's move on to the next slide. So resources for city employees. So we do have a question, who's eligible for EAP?
Yes.
So if you could just talk a little bit more about EAP. We did have a question earlier about the groups and going out to EAP and actually training. So can you just speak to the various services and
Sure.
the extended hours actually? Go ahead.
Yes, I'd be happy to. So everyone, right now, we have extended our hours. We're available, and counselors available from 8 a.m. to 11 p.m. We are all remote. We are accessible by text, phone, video. We do individual and we do group. And we also have citywide groups in the evenings. If you just want to hop on at any time, we have a Monday night group for relaxation techniques at 8 p.m. On Wednesday night, we have a group about grief and loss. We know people are losing loved ones, also having some grief about the life that they've lost, the new normal. Thursday night, we have a Spanish-speaking support group at 8 p.m. And Friday, we talk about resiliency. So we have a group about, we have our inner resources and resiliencies that sometimes through a really hard time we don't see, but we actually do have. So we like to put that on a Friday to people to enter their weekend with a little bit more of a positive shift. Don't hesitate to email us and phone. It comes right to us and we will respond very quickly.
Awesome, thank you. So the next slide, please. So Be Well, we are educational resource, wellness programming for all city agencies to help employees manage stress and develop resilience. And so you can contact us. You see our email there. You can also visit our website. We have plenty of opportunities for exercise. We have meditation, an opportunity for meditation every single day of the week, whether it be sunset, after work, or in the afternoon time. We will be sharing with you our wellness calendar so that you can register for the different events that are available. And please share with us through email services or programming that you would like to see in your agency, or even during this virtual opportunity. I'm sure that we will continue to do these type of webinars virtually throughout the summer as well. And so let's move on to the other resources that we have. So New York City Well is a free and confidential 24/7 mental health support for you or someone you care about. And New York City Well is open to everyone. It's not just related to, just open to New York City employees and their dependents. And they also provide texting and live chat services in English, Spanish, and Chinese, and have interpretation services in over 200 languages. One good thing if you visit the New York City Well website is they have a link to different apps that you can use, apps that are free, even free just for short periods of time, but have specific programming for COVID-19 that can help you with leading you through meditation and breathing exercise that will help you to manage anxiety at this time. And so New York City Well is a really great resource that you should take advantage of. And next slide, please. Health benefits program. So please do utilize your health benefits for any kind of services or information that you might need health related during this time. Everyone, for the most part, has a different health insurance. So you can visit these websites or email them directly at the website, at the email address that you see on the screen for your specific questions. And stay tuned for more programs and workshops from Be Well to help you build stress management skills. Okay. All righty. And so I think Kerry and Linda did talk about additional resources for employees to help you talk with your supervisor. EAP really is there to kind of help you have these kind of conversations. So if your supervisor is a stressor for you, they will help you walk through having these conversations. Employee assistance program is there to help you in any way that they can. So we do have a little bit more time. I want to thank everyone for joining in today. and participating. It was a really great conversation. So let's see if we have another one. Okay, so we do have a question. How do you approach your supervisor when your mental health is impacting completing your work and not make it look like you are just being lazy? Oh, is this the one we asked?
Yeah, I think that's the one we did before.
Yeah, we answered that.
All right, and someone else has, just curious, are any of the virtual exercise Zoom meetings being recorded? No, the exercise classes are not being recorded. But you can, there are several opportunities each day, so please join in if you would like. And they're adding classes again for next month, so please make sure that you continue to look at the schedule and join in. And someone asked, are these resources available for family members, kids, and spouses?
Yes. We do not define what family is. If someone calls in and they have a family member, and not necessarily their dependent, we will help. Some people have chosen family, some people have extended family. No one is going to be turned away. FDNY and NYPD and the uniformed the agencies have their own EAP, so we cover all like non-uniform EAPs and health and hospital. And anything that I've mentioned before, I know there was a question in there about how to join the evening groups. We're going to be sharing all of that information and the links to come into those groups at the end of this webinar.
Mm-hmm. And one person, she says, thank you for all that you do and the help I received prior to EAP and during this pandemic as well. Another person asked, if an employee indicates that a mental illness is affecting meeting deadlines and completing work, how should the supervisor handle lack of productivity?
I mean, that's a tough question without knowing a whole story, but what I can tell you how I approach it. I would say, like, number one, what is something that the staff member needs in order to support the struggle they're going through? And then really go to strength-based. What are they strong at right now to help them meet their deadlines? A really strength-based approach in terms of, like, again, what's wrong with them, but what's happening for them, and how do we help them lift them up in order to get the work that needs to be done.
Mm-hmm. All righty. And so one thing I didn't mention is that the unions also have employee assistance programs. And so because there's so many unions, it's hard to share that information. So if you are in a union, it'd be helpful for you to just check with your union to see what type of services are available to you as well. So let's see. Everyone seems to be very happy with this webinar. So thank you so much for participating. We're very happy that this information is important to you. Okay. Alrighty. Did anyone have any last words, ladies? Do you have any last words?
I just think that, this is a wonderful opportunity to share what EAP does, but to let people know that help is available. And if you reach out for it, you will be able to sort of resolve some of your issues and be in a more productive work environment, which is what we're trying to support. And we need you to come in so that we can make that happen.
All right. Awesome. Well, thank you again, everyone. Thank you, Linda. Thank you, Kerry. Thank you, everyone behind the scenes, Anna, Jorge, Toria. Everyone, there was a lot of hands that put this together, and I'm really happy this was a great success. And thank you, everyone. Stay safe, be well, and see you soon.
Thank you, Anna. Take care, everybody.
Thank you.
Bye-bye.